The uncomfortable truth about overweight and obesity. Beyond genetics. Ever wondered why obesity rates are skyrocketing? It's not just about genes. There's a deeper, more complex story to uncover. Let's explore the hidden factors driving this global health crisis and what we can do about it. The common narrative often points to genetics as the primary culprit behind overweight and obesity. We're told that our metabolism, or DNA, dictates our weight, absolving us of responsibility. But is this really the whole picture? Pharmaceutical companies often perpetuate this narrative, conveniently selling weight loss drugs. Their message is clear. It's not your fault. It's a genetic disease. This oversimplification ignores crucial psychological and environmental factors. Obesity can often be understood as a form of addiction. Food addiction. Like any addiction, it arises from an imbalance of three key elements: the substance, food, the individual, us, and the context, our environment. Zimberg's addiction triangle highlights how these factors interact. When they fall out of balance, addiction takes root. In the last 60 years, these elements have become drastically skewed, contributing to the obesity epidemic. Compare videos from the 1930s with those from modern Western cities. The difference is striking. People were generally thinner, more energetic, and fitter. Today, we see a population that is often slower, more tired, and more prone to obesity. Genetic evolution takes millennia, not decades. This rapid change suggests that something other than our genes is at play. The rise of ultra-processed foods and a hyperstimulated environment are significant contributors. In the 1960s, ultra-processed foods emerged, engineered with perfect combinations of sugar, fat, and salt to stimulate dopamine release. These foods are essentially psychoactive substances designed to be addictive. No one needs rehab for broccoli, but try taking sugar away from someone, and you'll witness the withdrawal symptoms. Food companies discovered the bliss point, the precise level of ingredients that triggers addiction. We live in a hyperstimulated, stressed-out society, disconnected from our natural rhythms. Technology, fast-paced life, performance anxiety, and social isolation all contribute to our vulnerability to addiction. Food becomes a readily available source of comfort in this environment. It's a quick fix for stress and emotional distress, further fueling the cycle of addiction and weight gain. Food marketing plays a significant role in shaping our eating habits. We are constantly bombarded with messages encouraging us to eat, from big breakfasts to constant snacking. This relentless promotion normalizes overeating. In the 1980s, sugar was even promoted as brain food. Marketing tactics targeted children with cartoons, mascots, and cereal prizes, hooking them on sugary products from a young age. Today, overeating kills more people than undernourishment. This is a terrifying paradox, highlighting the imbalance in our food systems and consumption patterns. Our bodies pay the price, with obesity, diabetes, and depression. Mental health also suffers as the body breaks down. The physical and psychological consequences of overeating are intertwined, creating a vicious cycle of poor health. The real change doesn't come from genes but from habits. We need to reduce our exposure to ultra-processed foods and rebuild a healthy relationship with food. This involves mindful eating and making informed choices. Engaging in regular physical activity is also crucial, ideally with the guidance of wellness professionals. Exercise not only helps with weight management, but also improves mental health and overall well-being. We need to stop glorifying overeating as a lifestyle. Instead, we should promote balanced diets, mindful eating, and a healthy relationship with food. This requires a shift in cultural norms and attitudes towards food. Most importantly, we need to become aware of the factors that influence our eating habits. Understanding the role of food addiction, marketing, and our environment is the first step towards making positive changes. Our mental and physical health are deeply connected. We can't heal one without taking care of the other. Obesity, inactivity, and depression are all interconnected and often stem from the same underlying issues. Addressing these issues requires a holistic approach that considers both our physical and mental well-being. This includes seeking support from healthcare professionals, therapists, and nutritionists. Food education is essential for empowering individuals to make informed choices about their diets. By understanding the nutritional content of foods and the impact of ultra-processed ingredients, people can take control of their health. Educational programs should focus on teaching practical skills, such as meal planning, cooking healthy recipes, and reading food labels. This knowledge can help individuals break free from the cycle of food addiction and improve their overall well-being. Mindful eating is a practice that involves paying attention to the present moment while eating. This means savoring each bite, noticing the flavors and textures of the food, and recognizing when you are full. By practicing mindful eating, individuals can develop a healthier relationship with food and reduce the likelihood of overeating. This approach can also help to increase awareness of emotional eating triggers and develop strategies for managing them. Our social environment plays a significant role in shaping our eating habits. The people we spend time with, the cultural norms we are exposed to, and the availability of healthy food options in our communities all influence our dietary choices. Creating supportive social environments that promote healthy eating is crucial for addressing the obesity epidemic. This includes initiatives such as community gardens, farmers markets, and workplace wellness programs. Policy changes can also play a significant role in promoting healthy eating. This includes measures such as taxes on sugary drinks, restrictions on the marketing of unhealthy foods to children, and subsidies for fruits and vegetables. By creating a food environment that supports healthy choices, policymakers can help to reduce the prevalence of obesity and improve the overall health of the population. These changes can also help to address health disparities and promote equity in access to nutritious foods. The long-term benefits of healthy eating extend far beyond weight management. A balanced diet can reduce the risk of chronic diseases such as heart disease, diabetes, and cancer. It can also improve mental health, boost energy levels, and enhance overall quality of life. By investing in healthy eating habits, individuals can reap significant rewards in terms of their physical, mental, and emotional well-being. This is an investment that pays dividends for years to come. We can change. We must. Start today, one step at a time. Together, let's break free from the cycle of food addiction and create a healthier, happier future for ourselves and our communities. Take action now. Educate yourself about nutrition, practice mindful eating, and advocate for policy changes that support healthy eating. Together, we can make a difference. With love, from the Psychology and Mental Health Channel.